This is the standard operating procedure for oropharyngeal swabs as part of the PLATCOV trial.
The swabs will be taken by designated study staff from day 0 through to day 7, day 10 and day 14.
The swab technique is shown here. The quantitative SARS-CoV-2 viral load result provides the study's primary endpoint. Swabs must be taken exactly according to this standard operating procedure, even if those guidelines differ from the procedures in your hospital. Personnel taking oropharyngeal swabs for the study must have completed training and received a sign-off for swab proficiency by the site PI. Full personal protective equipment should be used by the person taking the swab. Labelling the specimen tube. This information should be filled in a sticker label and stuck to the swab specimen tube or written directly on the tube in an indelible marker. It needs to be patient ID, your initials, date and time of sample collection, and type of specimen. The specimen is labelled as which side of the throat it was taken from. TSL is the patient's left side and RTS is the patient's right side. The left side is always taken first. Obtain verbal consent from the subject before proceeding. Make sure there is adequate lighting so you can see the back of the throat. Tell the subject that you will take a throat swab and it will be slightly uncomfortable. The aim of the procedure is to collect a sample of cells from the back of the throat, not mucus. Make sure both the patient and you are comfortable. Make sure the patient has not eaten, had a drink, taken medications, brushed their teeth or used mouthwash in the last 30 minutes. Plain water, not hot, drunk over 10 minutes ago is okay. Take the left throat swab first. Remove it from the packaging carefully. Do not touch the soft tip with your hands and hold the end of the shaft between the thumb and the forefinger. The swabbing procedure should only be conducted under direct visualization of the back of the throat. Ask the patient to say "ah." This should help you to see the back of the throat. If you are unable to see clearly, then the lighting or the position of you or the patient may need to be altered. If there is mucus on the tonsil, the patient may need to be instructed to clear their throat before the procedure. Do not rush the procedure and be smooth with your actions. Avoid the sides of the mouth and tongue. Place the side of the soft tip of the swab against the tonsil or in the tonsillar fossa so that all or the majority of this part is resting against the tissue or the space where the tonsil would normally be, the tonsillar fossa. With firm but not excessive pressure, there should only be a slight bend in the swab shaft. Avoid the very back of the throat, as this may cause gagging. Rotate the swab between your thumb and forefinger back and forth in a complete rotation 4 times. This should take approximately 4 seconds, 1 second per rotation. Afterwards, put the soft tip of the swab into the tube first, snap the swab at the breakable neck, screw the cap of the collection tube firmly closed.